Hello and welcome to everyone joining us this afternoon for another warm-up webinar leading into Workplace Wellness Festival 2022, which is only 3 weeks away. I'm Tanya Arlington, Event Director at Workplace Wellness Festival, and I'd like to begin by acknowledging the Gadigal people of the Eora Nation as the traditional custodians of the land we're broadcasting from today. We pay our respects to elders past, present, and emerging, and extend that respect to all First Nations people joining us today. We are super excited to be partnering with a team from LiveWell by Zurich, a health and wellbeing benefits reward platform, which has been developed in line with Zurich's focus on helping Australians live happier, healthier, and more fulfilling lives every day. Today, we'll be exploring how much focus there's been on mental health during COVID and whether physical health has been forgotten during our experience of the pandemic. Joining the discussion today, we have Dr. Denis Cronson, Chief Sales and Distribution Officer at LiveWell by Zurich, and Dr. Sally Phillips, Head of Health Services at Zurich's Life and Investments. Welcome, Denis and Sally. Denis, I know you're beaming in from the other side of the globe today, so thank you for taking the time to join us. And Sally, lovely to have you back on stage with us.
Lovely to see everybody, and awesome to spend time and speak about our favorite topics. So thank you so much for running the webinar, and looking forward to the process. Good. So I think just as an introduction, just to give you the context of today's discussion, we've seen a lot and heard a lot about the impact of COVID-19 on mental health globally, locally, regionally. In fact, it's been an international obsession over the last period of time, and respectfully so. And what we'd like to cover today is not necessarily the provocative question, but an important question, which speaks about whether there is an overemphasis on the care and support for mental health issues in the workplace. As you'll see as we go through the presentation, we will acknowledge and frame and go into some detail about the impact of mental health issues in the workplace and its specific relationship to COVID. But we will also try and emphasize that perhaps the dimension of physical health has in some way been subordinated in the process of focusing on mental health issues. So that's really going to be how we'll cover it. What we'd like to do is not to speak about it in an anecdotal sense, but support it with good hard science and good hard statistics. So it's an absolute pleasure to be joined in today's webinar by my colleague in Sydney, Dr. Sally Phillips, who is an authority of the impact of health and mental health, physical and mental health issues from an insurance and health perspective. So we'll introduce that line of thought as well as we go through the discussion. And then hopefully we'll stimulate some interest and questions. And so if there are any, you'll be able to position those on the chat, and we can jump into the responses and cover that in due course. So again, thank you very much indeed for the opportunity to evangelize and to talk about our area of work. So we certainly do acknowledge that the COVID-19 pandemic has been a huge blip on the radar screen. In many ways, for the good though, and what we'd like to show today is that it has had a positive contribution to the awareness and the support and the development and even the acceleration of mental health support in the workplace. So the impact is acknowledged. The issue though is that it's been really driven and spiked in two main drivers. The first one, as you'll see in a moment or two, is that the correlation exists between mental health impact and the cycles of COVID-19 flare-ups and waves in the local and global environment. So we really do see spikes of mental health deterioration as the waves of COVID-19 develop across the globe, and that's kind of intuitive. What's not as evident, but is also logical, is that the spikes in mental health issues do correlate with reduction in human mobility. I think ancestrally and evolutionarily, we were not designed to sit in rooms and be solitary beings. And so, logically so, the reduction in human mobility and the lockdowns really have impacted on the global health alignment. So you can see, doing a retrospective on mental health issues, there was a significant premium added to the burden of mental health baseline cases due to COVID-19. And the additional cases you can see probably amount to about a third on top of an already enormous number of mental health cases globally. What's also quite important to see is that, and also almost counterintuitive, is that younger people were hardest hit in the pandemic. You can see major depressive disorders and anxiety disorders were to a large extent spiked in the younger cohort, the 20 to 40-year-old cohort, where anxiety disorders were highest, and not in the older populations, which were viewed and evident to be the most vulnerable and the most frail. So that was counterintuitive. And what the research starts to suggest is that it is these employed, active, productive, younger members of the population who had greatest concern over the future consequences of COVID-19 in their world and the economic challenges which arose. And were perhaps impacted because of that concern, because of that simmering anxiety. So depression and anxiety really did manifest strongly in the younger cohort. The other perspective, also supported by a lot of good research, is that it is this cohort which was actually more consumed, maybe more obsessed by having greater access to social media and more orientated around, you could call it the information and misinformation spectre of COVID-19. So that's an interesting observation. The other one is that what some would call extraordinary measures to limit the spread of the virus, the great lockdowns, the use of masks, the enforced vaccinations, and I say by all of those respectfully, not taking a view on whether they're good or bad, have nonetheless impacted on younger people in terms of the onset of mental disorders and even suicidality. And we'll come to that in a moment or two. Just looking at the demographic spread of this, we're also seeing a greater prevalence of depressive disorders, anxiety in the female cohort. And you can see almost 2/3 of the additional burden of COVID-19 mental health issues manifested in the female population. So that's an interesting understanding of where and with whom and which age groups global mental health did manifest. So I hope that gives us a point of departure. As I said earlier, the impact of mental health illness has really tracked the pandemic trends, and that's very, very evident in this slide. And so you can see almost to date, up until April 2022, the cyclicality of depressive disorders, for example, as a dipstick of mental health, did manifest with the surges and the waves of COVID-19. And what we're seeing is that the employed populations were hardest hit, the employed populations. If we do a deeper dive into one of the waves of COVID-19, you can see, for example, suicidal ideation and increased substance use was really evident amongst, as you'd expect, essential workers, but really the employed population in general, as opposed to unemployed and retired populations. So very, very significantly, the workplace was carrying a significant burden of the mental health impact. Further to that, it's important maybe to just understand in a global context how mental health is being viewed. And so in a relatively dense and complicated slide, we'll look at the moment how global leaders have been visualizing mental health as a global risk and how they're prioritizing it in their world of impact. So this infographic really breaks down many different types of global risks, but we're going to focus obviously on mental health. And so you can see societal risks, technological risks, environmental risks, economic risks, and geopolitical risks are all represented. But very meaningfully, you can see that mental health deterioration is viewed by thousands of global leaders as an aggregate, as amongst the most important and the most prevalent of impacts in the world. And it's described as this pervasive representation of negative well-being, lack of social cohesion, loss of productivity, and the rising impact of things like anxiety, depression, loneliness, stress, and even accelerations of dementia in vulnerable populations. So it's a lovely way to visualize that it's not a forgotten or ignored issue. It is very much front and center, the impact of mental health globally. Having said that, though, it's important to realize that the workplace remains the key battleground for COVID-19 mental health fallout. And this research really shows a reason for that. Although work is, on the surface of it, a lot more flexible, the actual burden and the impact on an individual basis is very, very abnormal. We see, for example, the number of meetings per individual employed in the workplace increasing by almost 150% over the pandemic period. And I'm sure many of you have experienced that as well. Really, the number of back-to-back consecutive and really almost never-ending meetings taking place now virtually. And we've developed this pattern of literally stacking meetings and interactions on a continuous basis to accommodate the productivity which we think we need to provide. And at a different level, the impact of all of that accelerates the use of chat platforms, increases the average workday span, and obviously after hours work is a significant casualty in that process as well. So it's interesting to see these trends and how the workplace really does remain the battleground. Now, certainly the workplace has responded, and one has to acknowledge many, many really well-positioned, well-intentioned, and strong interventions which have been put in place. And we'll talk about these in a little bit of detail. We've seen how the uptake, delivery, and utilization of employee assistance services, particularly in the areas of virtual counseling, has increased enormously over this period. The connectivity and communications in respect of things like telehealth have also gained a huge amount of prevalence, and we'll touch on that again in a moment or two. Training and development of employees in respect of a remote workplace management has been a big focus to alleviate the impact of mental health. There has been strong leadership evangelism around mental health matters and issues, and some strong case studies and cheerleaders or opinion leaders or ambassadors in this space to drive the awareness and the management and the destigmatization of the process. A huge amount of care and support resources have been manifested, as has been the development of management layers in the organizations across the world. We've seen the emergence of job coaching on a remote basis to help alleviate some of the abnormalities, some of the aberrations, and some of the bad habits which have started to creep in and manifesting in poor mental health habits amongst the employees. And we've seen the well-positioned implementation of CBT, cognitive behavioral therapy, in the workplace, and we'll speak about that also in a moment or two. Destigmatization is so important, so critically important in the world of mental health management, has really gained a huge amount of prevalence, and it's been unbelievable to see how that has spread almost like wildfire all across the world. And finally, in the digital sense, how mental health applications have been really thrust to the fore to provide individuals and businesses with the ability to engage and impact on the way in which mental health has been so destructive in the workplace. So we've gone through a little journey up until this point to understand the impact of mental health globally, how it's manifested hand in hand with COVID, and what the workplace is doing. And I want to pause here to introduce Dr. Sally Phillips to look at it through the lens of insurance, of health, of employee benefits, and to give us a first-hand view of how this is being perceived by the huge and important and critical safety net that industry provides.
Great. Thanks, Denis. And I think if you think of COVID-19 and you think of sort of the four main factors that build up health, which is financial health, social health, mental health, and physical health, this pandemic has really shown us the importance of all four of those elements and how those elements interact. And I think Denis has sort of clearly articulated where the mental health challenges have come through. So the overload in the media, the change in the work-life balance, the social isolation, and in Australia, particularly in Victoria, where the lockdowns were probably the longest, or were the longest in the world. And this new return to normal, where people are still a bit concerned around, should they go back to the workplace, should they not? The mixing of the personal life and the work life have obviously been a problem. But I think in Australia, one of the biggest issues and biggest triggers that we're seeing from a COVID perspective is the financial fallout of businesses that are shut down, businesses that have been in lockdown, then come out of lockdown, then gone back into lockdown again. And this is really impacting much of Australia. And even though our unemployment rate is now really good, from a lag perspective, we're starting to see those claims come through from a life insurance perspective. I think as we move forward, what are we concerned about and what are we looking for? We're not seeing masses of claims for COVID-19 at the moment, even on a mental health perspective, but we are expecting probably a 10 to 15% increase in claims from a mental health condition cause to come through. And I think one of the top things that we are concerned around is burnout. So burnout is classified by the World Health Organization, and it's mostly related to overload in the workplace. What we're starting to do and starting to look at burnout through a lens in a broader perspective within Australia. And Professor Gordon Parker, who is one of the founders of the Black Dog Institute and works at the University of New South Wales, is starting to say, let's look at it from a carer perspective. Let's look at it through the COVID perspective, where you've got people that are juggling children, they're juggling their jobs, they're juggling trying to go to work, not go to work. Are masks on public transport? Are they not? So let's look at it through a broader perspective. And we know that from burnout or burning out, multiple things occur. And one of those is that physical illnesses and diseases can occur prior to the actual mental health crisis, sort of further down the line. So that is something that we are looking at and something that we are starting to turn our minds to as to what we do from an insurance perspective. There are three other areas that we're really concerned about from a claims perspective, and we're busy doing modelling on at the moment. So the first one is long COVID. So what we're starting to see coming through from the international publications is that whether COVID has been a severe infection or whether it has been a mild infection, for those that have been diagnosed with COVID-19, and this is Delta, Alpha, and some early Omicron, we're starting to see a few really concerning trends. So one of those is neurological, where we see that 15% of all patients who have had COVID, about 45% of these patients are starting to show some cognitive fallout or some cognitive symptoms. And some of those are going on to have the impacts on the ability to work almost 7 months after they've had the original COVID. These studies are not longitudinal at the moment. Obviously, the studies will continue, and most of them are coming out of the UK. But what they have shown in the UK, which is really concerning, is that MRIs done at the time of diagnosis of COVID-19, and this was with the Delta strain, and MRIs done 3 and 6 months later are showing changes in certain areas of the brain, being the prefrontal cortex and the parahippocampus. So these changes appear to be permanent, and is this a new disease type and a new type of dementia potentially that is coming, that is showing, its colours? So this is something that we are watching quite carefully, and certainly from an employee perspective, it's something that employers should be aware of, is that if employees are showing signs of just not being able to concentrate the way they should, that there are lags in the way that they are working prior to what they were working for before, is that they should get checked up by their GP. So that's one of the areas of concern. The other is cardiovascular, where we know that 15% of those with cardiac symptoms go on to show ongoing cardiac or myocardial injury sort of 2-3 months after. And again, this just means that people need to have ongoing checks. This has got significant impact, probably less from an employee perspective, but more from a critical illness or trauma type policy perspective under insurance. We also know that long COVID is associated with much higher diabetes rates and unmanageable diabetes rates. It's also been shown to have impact on the respiratory system. So again, if employees are showing ongoing respiratory symptoms more than 2 months post the COVID, again, they should probably be checked up by a doctor. Some of the patients are showing, and it's about 10 to 15%, are showing small airways disease post-COVID. So these are complications of a viral infection that we haven't seen previously. And at the moment, the medical fraternity are busy watching these and trying to see whether these are going to be permanent changes, whether this is something new for us, or whether this is something which will sort of taper down with time. The other big concern is obviously fatigue with long COVID, and this probably is the most common symptom that we see. And this fatigue is similar to chronic fatigue syndrome, where people are just not able to get up and not able to do their jobs. This is going to have potentially an impact not only on absenteeism, but on presenteeism as well. And presenteeism certainly is probably more of a risk in the workplace than absenteeism is. The other side that we're really concerned about is preventative screening and the lack of preventative screening that has gone on, and particularly in Australia over the last 2.5 years. The Heart Foundation in Australia has done some modelling, and they are anticipating an additional 350 deaths due to stroke or heart attacks in the next 5 years. And this is because roughly 27,000 people have not had their heart check in the last sort of couple of years during COVID. So this is particularly concerning because there are people with raised cholesterol, raised blood pressure that are unaware, that are in our population group and potentially could die from this. So you'll probably see in the media that there's a strong push to get these heart health checks to go and see the GP. The other really concerning statistic, and I find this one really confronting, is that in April 2018, roughly 74,000 mammograms were done in Australia. And in April 2020, only 1,500 were. And that's a significant drop-off in the number of mammograms, and this is due to COVID, which means that there are many females and a few males that potentially have lumps in their breasts that haven't been examined, they haven't had routine screenings, which means that the stage of cancer that's going to be picked up is much later than it could have been. And this goes for other cancers too, including skin cancer. So really strong push to do preventative screening. And then the fourth concern that we have from an insurance perspective is the chronic disease management, where people with diabetes, with hypertension, with mental health conditions potentially haven't been compliant on their medication, haven't been able to access some of their medication, haven't seen their doctors on a regular basis. And potentially these chronic conditions can then move into more progressive conditions, so of greater severity, or that they can have further complications. We know that about 47% of all Australians have a chronic condition. And the three biggest chronic conditions in Australia are mental health conditions, which is what we've been speaking about up to now. The second are back conditions. And again, in the workplace, this is pretty significant because if those backs haven't been managed adequately, and remember, people are moving from their chairs in their back rooms or their dining room chairs or their home studies back into the ergonomic design chairs in the workplace. So there's changes in that. So this again could impact these chronic conditions. And then the third major chronic condition in Australia is arthritis. And again, potentially for people that haven't been moving as much as they should do, is this arthritis going to exacerbate over the next few months. So just to sort of summarize, we are concerned about mental health conditions. We haven't seen the mass that we expect to see. We do anticipate a growth of 10 to 15% in mental health claims, particularly related to burnout. And we are also watching, we haven't seen at this point, but we are watching the impacts of long COVID. We're watching the impacts of the lack of preventative screening, and we're watching the impact of lack of compliance and management of chronic conditions, both from an employee perspective in our group insurance as well as in our retail insurance books. And with that, thanks, I'll hand back to Denis to go through a little bit more on what's causing some of these things. Thank you.
Brilliant. Thank you so much, Sally. That is really a invaluable insight into the manifestations of COVID as seen through the lens of the insurance, the medical, and obviously the general community as well. So what we'd like to now transition into is the logic which says we acknowledge the mental challenge that COVID-19 has brought about in terms of mental health, but has physical health been forgotten in terms of its contribution to the broader intervention set in health and well-being in the workplace? And so we'd like to put the thesis across in a very strong way to make a case for physical health interventions. Now, we're not just saying take one part mental health and one part physical health intervention, mix them together and you're all good. What we really want to do over the next couple of slides is give you a deep insight into how powerful physical health interventions can be and how well positioned they are for really contributing to a strongly balanced, strongly blended, and ultimately synergistic delivery of health and well-being intervention in the workplace. We're not undermining the impact of mental health, and I hope that's coming through very, very strongly. We are suggesting that there's an unbalanced focus on mental health interventions and maybe even worse, purely responsive mental health interventions, or even pure mental health interventions in the workplace. The graphic on the left-hand side illustrates this. We see over the last 2 years a huge acceleration in the investment in mental health in the workplace, almost 100% or 90% increase in mental health investment, so a doubling of investment in workplaces. We're seeing almost a doubling in telemedicine support. We're seeing a huge amount of investment in the area of stress management, resilience building, mindfulness and meditation, and then obviously in preventative care of COVID specifically to a much lesser extent. So a lot of intervention is taking place biased towards the mental health side, appropriately so, but on an unbalanced basis. And the one point which I'd really like to strongly make, which is sometimes missed in the kind of broader emotion around COVID, is that really the lessons we've learned about COVID are that it is metabolic health, hardcore chronic illness, which drove a lot of the morbidity and mortality in COVID outcomes. You can see in this very interesting plot how pervasive the impact on mortality was in those individuals who had the clinical signs of elevated blood lipids, of elevated inflammation, of elevated blood glucose, of high blood pressure, evidence of obesity, and we put them all together, metabolic disease. So the greatest impact in terms of mortality as well as morbidity, and I would suggest, as we'll see soon, Sally, the biggest impact on long COVID will be amongst those individuals who have an underlying poor state of metabolic health, physical metabolic health. And so maybe we can look at it in two ways. We can understand how important physical health is from a broader workplace perspective, but also we can appreciate how powerful physical health could be as an inoculation against the future impact, not only of COVID-19, but its successors to come. And so what we'd like to really put forward is the synergistic logic, which says physical health and mental health both have a massive role to play in the improved management of workplace well-being. And we'll support that with a really interesting and profound emerging base of science. So what I'd like to do is jump in and really cover some of the important foundations of mental health in the workplace And in that space, we'll cover exercise and activity and put forward the thesis around those. We'll speak about diet and nutrition. We'll cover the important area of sleep. As Sally already mentioned, the important contribution that the improved management of chronic conditions and medication can make. And as an aside, we'll not necessarily as an additional focus, we'll speak about the compelling area of breathing and breath work and how that can improve the contribution to physical foundations as well. So those are the categories of physical health improvement we'll be targeting over the next couple of slides. And what we hope to do is not only position the logic, but also show how well supported this is in science. So the first area is exercise and activity, and very close to, I'm sure, the heart of many workplace wellness practitioner. Now, exercise specifically drives a huge change, a profound change in the neurochemistry of individuals. And when we say neurochemistry, we're obviously saying the ability to impact either positively or negatively on the nervous system or the central nervous system specifically. And it's important to appreciate that the brain does not exist in a vacuum. It exists in a sea of cerebrospinal fluid, which is strongly, call it, bathed in important neurochemicals. And exercise impacts profoundly on those chemicals. And we're not going to jump into all of the impact specifically, but it is just a nice visualization in how many drivers there are, how many regulators, how many drivers, how many influences there are on the central nervous system through the impact of exercise. So in no particular order, we see the neuroprotective effect of exercise, so the reduction in inflammation on the central nervous system by a well-constructed exercise program. We see an improvement at a cellular level in mitochondria, and so the resilience of the central nervous system to resist mental health decline. We see significantly improved cognition, so thinking, mental clarity, coinciding with well-constructed exercise programs. So there's absolutely no doubt in the scientific literature that exercise has got a profound impact on mental health. And then looking forward in the longer term, the improvement in neurodegeneration and ultimately in longer term dementia. So it really is both a short, medium, and long-term inoculator against mental health decline from a neurochemical perspective, purely a neurochemical perspective. Metabolically, exercise obviously has a profound impact on blood sugar and insulin. You can see in this graph, if you follow the purple line from left to right, that as one implements exercise, the sensitivity of the body to insulin improves. And that's important for a number of reasons, which we'll touch on in a second. Even after exercise, we see a long period of heightened sensitivity to insulin in the body. And so what's happening is that the sensitivity to insulin improves the uptake of glucose, which is blood sugar, into the body and reduces its broader impact, its broader oxidation and glycosylation of important amino acids and other structures in the body. So insulin sensitivity is a profoundly important issue in the area of metabolic health. And so that's why exercise is so important in driving all of that. And again, without going into a huge amount of detail, we see the trickle-down effect of insulin and its impact on depression and anxiety. And we see that it improves cognition, brain function, and mental health impacts. So it's a very, very important regulator and contributor to mental health improvement. Sleep, obviously, has got a bidirectional contribution to make on mental health. And exercise significantly improves sleep quality. As you can see in the graph, light exercise, moderate exercise, and vigorous exercise all improve the proportion of very good and fairly good sleep in individuals and really compresses the prevalence of bad and very bad sleep in individuals. So again, a well-constructed exercise program can meaningfully improve the ability of an individual to have restorative, restful, and mental health supporting sleep. So there's a very good thesis for exercise and activity. As Sally mentioned, the longer-term contribution of long COVID and the impact on things like ergonomic issues, arthritis issues, does have a lot of context, and the improvement that exercise can make in issues like mobility, pain reduction, and the support of arthritic and ergonomic issues is probably well appreciated. And then on top of all of that, the longer-term improvement in immunity and inflammation with well-constructed exercise programs and incidental activity focus does come into the frame as well. So hopefully we've been able to put forward a strong case for exercise and activity as a critical foundation in a physical sense for mental health improvement. Transitioning in the same sense, we now focus on diet and nutrition. Another very exciting area, well-supported area by emerging and contemporary science, and something certainly which is close to Sally's heart and mine in being able to contribute to alleviate the burden of mental health. Again, the specter of blood glucose needs to be considered. Again, without going into a huge amount of detail, we see how the maintenance of stable levels of blood glucose can improve cognition, so thinking, cognitive function, executive mental health, mood, attention, memory, emotions, an improvement in psychosis, an improvement in motivation, and support for things like addiction and compulsion. So there's an incredibly important focus to be made in maintaining stable levels of blood glucose over the course of the day. And without going into the dietary and nutritional strategies, these are the types of interventions which can be brought into the workplace through education and awareness and training, and maybe into the realm of catering and food provision. Insulin resistance obviously has at its core effective diet and nutrition. And I'm sure all of you on this call would have experienced the roller coaster ride of your daily spike and crash blood sugar cycle. We wake up, we eat something of a high carbohydrate nature. The sugar is broken down, absorbed into the bloodstream. Insulin is released. The blood sugar rises and then starts to fall with the insulin impact. As it crashes, the body releases stress hormones, adrenaline, noradrenaline. It releases other stress hormones like cortisol. And in response to those stress hormones, the body feels jittery and dizzy and anxious and angry. And what do? We reach for the Coca-Cola, we reach for the chocolate bar, we reach for the next comforting carbohydrate containing snack, and the cycle repeats itself. And every time the cycle repeats itself, there is a gradual, incremental, but inexorable impact on insulin resistance. So this is the other side of the coin, where exercise improves insulin sensitivity, poor diet, and the daily roller coaster ride of carbohydrate-driven spiking and crashing really deteriorates the state of insulin resistance. So it's an important area of communication and education. Ultra-processed food. Some people describe ultra-processed food as any food that has more than 5 ingredients on the label. We don't have to be that dramatic, but I think we all get a sense that ultra-processed food is becoming a pervasive risk in the world of diet and nutrition. And again, without going into a huge amount of detail, what we're seeing in the science at the moment, if you look at the blue blocks, is that the impact of highly processed food, driving obesity, driving high fat intake, really does impact negatively on cognitive ability, on spatial memory, on depression, anxiety, on mood, on things like appetite, on lethargy, and anhedonia, which is really the lack of positive emotions and motivation. Through inflammatory processes and through the glycosylation, the kind of pickling of important neurological structures by high glucose in the in the diet and in the bloodstream. So we can see that ultra-processed food has a huge amount to contribute. Exactly in the same way, the inflammatory effect of things like gluten and some of the seed oils need to be considered. The graph that you're seeing at the moment is that both in individuals who are highly sensitive to gluten, even people with celiac disease, but even in people who are just slightly sensitive to gluten, so non-celiac gluten sensitivity, the NCGS, we see impairment of concentration, confusion, of forgetfulness, of grogginess and detachment. So mental health symptoms can be impacted negatively with even slight sensitivity to things like gluten, and seed oils contribute in that way as well. And obviously, these have at their roots the important area of neuroinflammation, inflammation of the important structures in the central nervous system. So we've covered exercise and its first cousin, diet and nutrition, and they're both two sides of the same coin. But we also need to acknowledge the critical importance of sleep in the foundational structures of mental health support. Now, there is definitely a bidirectional relationship between sleep and mental health. And without going into a huge amount of detail, we literally acknowledge that sleep drives significant mental health deterioration, and independently, mental health issues impact on sleep. So there really is a bidirectional relationship. Improvement in the one has this positive feedback cycle. Deterioration in one has a vicious cycle of deterioration. And so there's such a huge amount of benefit to be gained by focusing on areas of sleep, sleep hygiene, and as you'll see in a moment or two, CBT, cognitive behavioral therapy, around sleep itself. And this is an incredibly interesting study which speaks about the volume of sleep and how it impacts on the critical markers of mental health. Again, without going into a huge amount of detail, you can see, if you look at the blocks, anxiety, depression, distress, mania, and thoughts of self-harm, all correlated with the amount of sleep that an individual gets. So that Goldilocks zone of 7 to 9 hours really does correlate powerfully with the emergence and prevalence of anxiety, depression, mania, and mental distress and self-harm in a very, very consistent way. And in the bottom right-hand picture, you see how a sense of well-being inversely is correlated with the same volume of sleep, that 7 to 9 hour window of quality sleep. So really compelling research demonstrating the support that adequate amount of sleep can provide to mental health management. We also understand that certain jobs can impact negatively on sleep. And the area of shift work comes in to the fray when we discuss sleep deprivation, but that's not the only job type which has a negative correlation with sleep. And it's important to understand that as custodians of workplace wellness, when we look at our workforce and how maybe in a very invisible way, in a very gradual, in a very attritional way, we're impacting on the ability of individuals to cope from a mental health perspective through the physical impact of their job. And this manifests, as you can see, in the areas of memory, concentration, mood, immunity, and increased risk of metabolic illness and accidents. Finally, the area of sleep apnea. And again, the bidirectional contribution that sleep apnea, or the difficulty of breathing intermittently over the course of the night, has on depression, and reciprocally how depression impacts on sleep as well. So in the center, you see this vicious impact of both obstructive sleep apnea and depression manifesting as a mental health outcome. But the good news is there's a huge amount of good science supporting the implementation of scientific-driven therapies to improve sleep and things that can be implemented in the workplace. Cognitive behavioral therapy, which focuses on sleep hygiene, the control of stimuli, the management of restrictive issues around sleep, relaxation and cognitive tools can really make a profound difference in the way in which sleep is appreciated and manifest as a strong support base for mental health improvement in the workplace. Sally mentioned the important area of chronic illness, and here we really do have to acknowledge that regardless of the science that you look at, there is an absolutely overwhelming base of evidence to correlate the prevalence of mental health with the underpin of a huge number of chronic illnesses, both cardiovascular, renal, and metabolic. And so again, the well-constructed management of chronic illness, the emphasis in the workplace of the importance of managing high blood pressure, of managing elevated blood lipids, of elevated blood pressure, all have significant correlation with mental health support as well. The impact of medication management and the side effects that those can have on mental health is another area of low-hanging opportunity. So again, the awareness, the education, and the support of individuals with chronic illness and the understanding of the side effect profile of their medications is an important learning. We also understand that as a chronic condition, overweight and obesity has a very nuanced but very significant relationship with depression, anxiety, and other mental health disorders. And whether that's through its metabolic impact, whether it's through its lifestyle impact, whether it's through its behavioral impact, obesity and depression are very, very strongly correlated. And so the management of one impacts very positively on the management of the other. Finally, a quick word on breathing as a mental health foundation. We know that there are multiple techniques, and we're not going to cover them today, but there are multiple techniques which support the development of strong physical health outcomes. We know that most of these, many and maybe even most of those, have at their core the improvement in the control in the autonomic nervous system. So you all know there are two kind of sides to your nervous system. The one is the parasympathetic nervous system, the rest, relax, and recover part of your nervous system. The other one is the sympathetic part, your flight or fright type of nervous system. And breathing really provides support to the parasympathetic system in the main. And this can have a very, very significant impact on mental and physical health. So you can see that the control of the autonomic nervous system in terms of its impact on cardiovascular system, respiratory system, gastrointestinal system, and the ability to positively influence the autonomic state in the body really does feed into the improvement in sleep, in rest, recovery, in the repair and building of muscles, and the release of positive hormones in the broader body. So there's a powerful contribution that breathing can make. So hopefully we've been able to position the dimensions of exercise, diet, chronic illness, sleep, and breath work as just 5 of probably a greater set of physical health interventions which can be applied in the workplace. And pulling that all together, what are the implications for practitioners like yourselves? So very, very quickly, and without going into an expanded discussion on these, because obviously this is your world and you'll need to now adapt these messages for your own application, we hopefully have come to appreciate that the case has been made for a blended format of health and wellness interventions. To add to the responsive and proactive mental health package, which has been prioritized in the workplace, with a strong physical health intervention platform, an ever-strengthening physical health intervention platform. Obviously, in the new world of working, digital delivery has become a critical component. And a well put together, holistic digital wellness function needs to contain a dimension of measurement of biometrics or neurometrics or behavior. It has to provide a population in the workplace with a strong and ethical content and learning layer. It needs to provide well-constructed, well-based instruments for risk assessment. It needs to provide strong touch points for responsive and proactive mental health support like EAP and telehealth. And it needs to hold the engagement and attention of users in the workplace on a consistent basis, which brings to the fore the importance of gamification and behavioral economics. So all of those need to be packaged into the blended delivery of a holistic digital wellness program in the workplace, or the linkage that organizations have to their remote workforce is significantly affected. And as Sally mentioned right up front, the focus areas of emotional health and physical health and social health and financial health and intellectual and occupational health are all simultaneously important in the delivery of a wellness foundation in the workplace. To leave out just one of those gives a very lopsided flavor to the delivery. We've also seen the massive benefit in the synchronization of the wellness custodians or the wellness contributors in the workplace. Human resources, risk management, health and safety should be synergized and more cooperative in terms of their contribution to critical KPIs of health and well-being. Employee benefits also has a massive contribution to make to improve the foundation for the support of individuals and to ensure that the safety net is ever improved. And finally, we are in a different space. We are in a different world. And the measurement of wellness interventions in the workplace is transitioning very, very rapidly. So the measurement and evaluation of wellness programs in the post-COVID era, in the era of remote workforces, in the era of increasingly virtual and digital service delivery is incredibly important. And that's a discussion of many hours in and of itself. But at a very, very high level, it's critical to understand the uptake and utilization of the diverse programs which organizations are delivering to their employees. A spray and pray approach that because we're offering many, many sweets in our lucky packet that they're all going to be enjoyed and used and appreciated is a worthless strategy. We need to identify in every organization, because they are going to be different, what the key risks are and how well those are managed. So the KPI identification is a critical part of a well-developed wellness program in the workplace. And finally, as Sally started to allude to, a very, very strong vigilance on the consumption of specific employee benefits and on the claims patterns and trends, which are emerging retrospectively, but as a critical barometer of workplace health and well-being. So I'd like to stop there with about 10 minutes left, I think, in our slot to ensure that we can cover some questions. And also just to consolidate the understanding of these points and maybe discuss them in a bit more detail should there be any requirement for clarification. So I'll just stop before we close and open the floor to any questions if there are any. Otherwise, we can do a very quick wrap. Okay, so sometimes we anticipate that there might be either from a basis of confusion or a basis of hesitancy, a little bit of a lack of questions. So I have put together one more slide, maybe just to close and to pull together many of these threads which we've spoken about today and give us a peep into what I think certainly is an exciting window of health and well-being intervention in the workplace. So I'll just close with an animation, which hopefully will give you a sense of the exciting new area of corporate health and well-being. We call it Corporate Wellness 2.0. So the framework of the contemporary corporate wellness model really does focus on two dimensions. One, the strategic pillars of the strategy, and two, the actual interventions themselves. So the critical pillars of contemporary workplace wellness would be a powerful leadership and evangelism, an alignment with formal organizational strategy, whether that is commercial, HR, or operational strategy. It is access to programs in many different ways and increasingly in a virtual and digital sense. It is scope, as we've discussed in many instances today, the scope of wellness delivery and the leveraging of data to improve an understanding and the development of an intervention set over time. And then the 5 critical areas of contemporary corporate health and wellness is the management of a remote workforce. It's unlikely we'll ever go back to the pre-COVID structure of on-site work, and I think it's important to start to blend this into a critical response by way of strategy. So digital engagement, improvement in touch points, diagnostics, the connectivity of individuals in a social sense, and as I've mentioned already, the critical importance of gamification and incentivization. A total health focus, not only in the way in which you've described physical, emotional, social, financial, and organizational health, but also multi-generational focuses and diversity and inclusivity. So we really are catching everybody in our total health focus. A well-constructed strategy in a contemporary sense also needs to understand that we're managing populations, and a blend of preventative health, lifestyle risk, disease management, as Sally's already alluded to, disability and incapacity are all critical in improving the broader risk of populations. As I alluded to in the previous slide, pulling all of the custodians into risk management from a wellness perspective are important. HR, employee benefits, health and safety individuals, risk management, and the broader wellness infrastructure of an organization are all important contributors to the burden of mental health and of health and well-being. And finally, the integration of clinical services. This hardcore health and medical support, screening, vaccination, things like telecare, the improvement of counseling and advisory support, on-site medical surveillance, etc. At the heart of a well-constructed corporate wellness strategy, we have the importance of integrated and successively evaluated strategy, of strong engagement tools, the leveraging of digital platforms, of really improving the connectivity of data sources and ensuring that we are ticking all the boxes, crossing the T's, dotting the I's when it comes to things like data protection, privacy, confidentiality, and other compliance areas. So I hope that gives you a sense of how all of the things we've spoken about today, how the logical correlation of mental health support and physical health interventions can come together and be formulated into a powerful, contemporary, and sustainable corporate health and wellbeing strategy for workplace wellness practitioners. So it's been a pleasure to spend time with you today. Thank you enormously from our side. And again, if there are any questions, we can quickly cover them now, or alternatively, we'd be happy to correspond with you after the webinar and fill in any gaps.
Thanks. I might just pick up David's question because just putting the answer in the chat. I think, David, you're quite right. In a large workforce, you certainly can look at stratification of things like cardiovascular disease and certain cancers if you're looking at those particular programs. But I think if you're looking at foundations of health, so sleep, nutrition, sleep, nutrition, and movement or exercise, that can be through the whole population, and that probably is the foundation. Preventative screening strategies, definitely by age and gender, and there's a really good life cycle for preventative screening that the Royal Australian College of GPs has, and you can get that off their website. And then the more structured programs would be by age and probably by disease process. I hope that answers the question.
There's another question here from Sam Aldred about Sam Aldred's in the fitness industry and interested to understand what tools you use to encourage and motivate members to exercise.
Yeah, I mean, it's a really exciting area, Sam. Thank you for the question. And again, one has to use the tools which work in the channels of communication in the workplace. So if there are strong and well-developed digital channels of communication in the workplace, then the communication and marketing and promotion of initiatives like corporate challenges, like social activity events can really, really work well to put everybody onto the same page and focus on a collective goal as well as an individual goal, and to use peer support, evangelism, and acknowledgement to really drive a broader culture of activity and exercise in the workplace. If there are on-site resources, the marketing and communication, the availability of on-site resources for exercise and activity can be well constructed. If there's a culture in maybe a smaller organization where individuals can, in certain work breaks, collectively participate in exercise is critically important. But really the evangelism and the communication in an organization that exercise is a central pillar for both mental health, for performance, for cognitive ability, for cohesion of work colleagues, and for the resilience of teams is an important message to drive on a continuous basis in an organization. So it's really part of the critical wellness communications mix. So many tools, many techniques, and all of them have to be aligned with what has worked, what hasn't worked, what the culture is, and what the communications channels are within an organization.
Brilliant. Thank you so much, Denis and Sally, for joining us this afternoon and sharing such a thorough coverage of this sort of integrated story between mental and physical balance. And if anyone would like to hear more from the LiveWell team, they'll be at Workplace Wellness Festival in a couple of weeks. And don't forget to register now and get your tickets. There are still some tickets available. You'll get to hear from over 100 speakers. You'll get to meet over 50 service providers. And yeah, it's going to be in person for the first time in a few years. So make sure you book in and we'll see you all there. Thanks for joining today.